Hello everyone, this is Dr. Logan here, and today I would like to tell you about the jaundice, which you people must have heard in your life. So, what is jaundice? First of all, it is not a disease, rather, it is a sign or symptom of a disease. For example, let's say fever, it is not a disease, it is a sign of a disease like malaria, dengue, or cold, etc. Now, again, let's come back to the topic. What is jaundice? It is a yellowish discoloration of the tissue due to the accumulation of the bilirubin, and this condition is called hyperbilirubinemia. Here the suffix emia is referred to the blood or related to the blood to the any product which concentration is high or lower in the blood. Now before talking about the detail, let's talk about the normal parameter of the bilirubin in the blood. Normal serum bilirubin level in the blood is 0.1 to 0.3 microgram per deciliter. We notice yellowish color discoloration of our tissue when the value crosses 3 microgram per deciliter. It also has subclinical form, which means the signs and symptoms are not visible to us, means it can be detected via only biochemical analysis, and here the value of the bilirubin ranges from 1 to 3 microgram per deciliter. Now the question arises that how will you guys come to know that you are getting sign of jaundice, and what are the sites to be examined so that you can say that someone is affected of jaundice. Straight away you have to check the upper bulbar conjunctiva, which contain elastin, has very high affinity for bilirubin. Now secondly, go for base of the tongue. After observing the base of the tongue, now move to the mucous membrane of the palate, especially soft palate. For more confirmation, look at your palm and sole of your limb. Lastly, focus on the general skin surface. Here you will find that the skin color is changed to yellowish discoloration. But remember, there are other reasons also which give similar signs and symptoms. The first condition is keratinoderma, in which discoloration is limited to palm, sole, and forehead and sclera. Second condition, like you may have taken drugs like quinine. Here only skin, urine, eyes are yellow. Conditions such as excessive exposure to phenol also give the similar signs and symptoms. Now let's move to the types of jaundice. There are three types of jaundice: prehepatic, which is also known as hemolytic, and second is hepatic, and third is posthepatic, which is also known as obstructive and surgical jaundice. Now let's discuss about the prehepatic jaundice, which is also known as hemolytic jaundice. It is happen whenever there is a breakdown of RBC occur due to any reason. It may be trauma, parasitic infection like malaria, babesia, dengue, or immune mediated hemolysis, etc. A reaction happen with the heme part of the RBC, and in this reaction heme convert into biliverdin in the presence of heme oxygenase. The biliverdin again reacts with biliverdin reductase enzyme and converted into bilirubin. And if the bilirubin level increase in the serum of the blood, the hyperbilirubinemia condition come into the picture. Now let's talk about the hepatic jaundice. Here liver is totally responsible for this type of jaundice. Liver have ability to conjugate the bilirubin. In this type of jaundice, both unconjugated and conjugated level of the bilirubin is increased in the blood serum. This type of jaundice is occur when the liver is affected with any disease like viral hepatitis, alcoholic hepatitis, drug toxicity, or autoimmune hepatitis, etc. Now the last type of jaundice, that is obstructive jaundice or the posthepatic jaundice. As the name suggests, this type of jaundice is neither related to the hemolysis or hepatic disorder. Here the condition or a problem arise due to the obstruction in the path of the bile, where it can be intrahepatic or extrahepatic. There may be the reason of cancer, gallstone, or any obstruction in the path of the bile. In early cases, we see clay, colored stool, dark urine, pruritus, which means intense itching, or and generally the yellowish discoloration. In later phase of the cases, these conditions like xanthelasma, xanthomas, weight losses, and increased bleeding tendency due to malabsorption, and the fever, rigor, pain are the general signs and symptoms of the condition. So okay guys, that's all for today. If you have any doubt, do ask your question in your comment box by adding hashtag Dr. Logan before your question. And also let me know on what other topic you want in the next video. And if you find this video is informative, please share it to your friends. And once again, thanks and take care. Bye bye.